third hour of the Elias Macko Show on this Friday, February 17th. Thank you for listening. Now, in January, we found out that Montreal Canadiens star Cole Caulfield would miss the remainder of the season. Suffering from an injured shoulder, the left-winger underwent orthopedic surgery, but the Habs star didn't choose to sit in line with the 39,000-plus people waiting for orthopedic surgery in Quebec. Caulfield went the private route, leading many to ask, if a hockey player has access to a fast track, why not me? Let's talk now to Dr. Philippe Dahan, orthopedic surgeon at Clinique Médicale Lacroix. Dr. Dahan, welcome to the program.
Thank you. Good morning, Mr. Makos.
So let's talk about orthopedic surgery. First things first. Cole Caulfield, I hear it was a tear, other types of surgeries, torn ligaments, and on and on. When we talk about orthopedic surgery in Quebec and the types of things that Quebecers are waiting for, what are we talking about?
Well, it's a lot of different surgeries. The surgery that probably Mr. Caulfield was going to get is what we call sports medicine surgery, which is usually arthroscopic surgery of the shoulder and the knee. Those are mainly day surgeries. So you get operated, you go home the same day. And the patients are also waiting for bigger surgeries like knee and hip replacements where they need hospitalization and need to stay in the hospital a little more. So combination of both of these patients. With the pandemic, you know that the orthopedic patients were probably the patients that were the mostly affected because they were put on the sideline for almost 2 years. During those 2 years, I was chief of staff at the Cité de la Santé, and I was fighting every day to try to get ORs for our orthopedic patients because they had knee pain, shoulder pain. Their quality of life wasn't doing well, but they weren't at risk of dying, so they were all unfortunately put on the side for those 2 years, and that just made the waiting list go up and up and up, and that's what made me take my decision.
And when you say take my decision, what was that decision?
Well, the decision to actually move to full private practice. I felt that I could offer the Quebec population much easier access to my services, and at the same time, I could give them, I find, in certain cases, better quality of care. Let me give you an example. For example, you hurt your knee this weekend skiing. You have to, first of all, get an appointment with your GP, which we know in Quebec is very hard to find. Then your doctor has to send you for an MRI, which in the public system sometimes can take an extra 6 months. Once he gets the MRI, he has to send you to the orthopedic surgeon, try to get an appointment with an orthopedic surgeon. We had more than 3,000 consults waiting at my office. Once you see the surgeon, he tells you he's going to operate you, and I was always hoping the patient wouldn't ask me how much time, because then there's another year to wait for the surgery. Mm-hmm. So then the quality of the surgery and the results of the surgery are not the same when you have to fix a tear of a shoulder within 6 weeks, which is what's recommended. And when I see it 2 years later, then the tear is not the same. It's not repairable the same way. The results won't be the same. So that's what I mean by taking my decision and trying to give better quality of care and better access to my services.
And also along the way, along the time you're waiting, right, the impact on quality of life. You mentioned, people waiting on the sidelines here. Let me ask you. You just told us what happens in the public system right now with the waits and all the steps. What happens right now in the private system?
Well, for example, like I said, you hurt your knee this weekend. You can come see me on Monday, take an appointment with the orthopedic surgeon. I examine you on Monday. I can prescribe an MRI. If you obviously, again, you can do the exam in the public system. You can pay to get your MRI done within the next week. And I see them the week after. And if we need to do a surgery or if we need to do any kind of treatment, we can start right away with a treatment plan. The physio can start right away. So they're back on their feet much faster.
So, listen, when we start off, we were talking about Cole Caulfield. He's a hockey player. He's a millionaire. He's got the Canadiens behind him. Of course, he's got access to that kind of thing. But who are the types of people coming to you, Dr. Dahan? Give me a typical example of someone, the type of Quebecer that's saying, you know what, I don't want to wait, and they come to you.
Honestly, Mr. Makos, open the phone book and put your finger on any name. It's any kind of patient. It could be workers that are a 50-year-old worker who's trying to get back to his job because he can't lift weights because he hurt his shoulder. It could be an older patient who can't get an appointment because their GP to get a cortisone injection. There could be some athletes that don't have the access, that they don't play for the Canadians. They're in a high school or a college team, but they don't have the access to that kind of, they want to get back to their sport. So it's really any kind of patient. I get patients from every area. I get patients from Ottawa, from Hull, because they can't get access to an orthopedic surgeon in their area. So it's really anybody. There's no specific patients that I can pinpoint. It's really anybody who needs the access.
We're with Dr. Philippe Dahan, orthopedic surgeon at Clinique Médicale Lacroix, talking about orthopedic surgery and wait times in Quebec. So, Dr. Dahan, if it just, there's no stereotype, it just seems like any type of Quebecer, even people outside of Quebec, are coming to you. I guess this leads me down to the path that it can't be as expensive as I imagine. Is that the case? Is it actually something that is reachable for a lot of people if you're seeing a different type of clientele depending on the day?
I mean, it's hard for me to tell you, Mr. Ray, who has the finance to be able to pay for surgery. Obviously, it is expensive. But if you would get the bill of the same surgery that we do at the hospital, you would find out that we're pretty close to the same price that they're charging you at the private clinic. But patients come and see me, and you know what they tell me? They're like, "Doctor, I went to Cancun last summer with my family. I put $10,000 for a week, and this year it's my knee that's hurting, and I feel that my health is worth it. So I'm investing in my health and my quality of life." And a lot of people find that's unfortunately a decision they need to take now with the way the public system is working.
And just on the notion of quality of life. Do you have a story about how going the private route made just a huge impact on quality of life?
Well, it's maybe a little hard to say for me because, like I said, I started practicing in January. So it's hard to have a big follow-up on the whole quality of life. But already, I mean, just so many patients just being in my office. Another part of going to private was having more time with my patients. Sometimes at the hospital, I would have to see 60 to 80 patients a day. So that's a couple of minutes for each patient. I don't have time to learn about their quality of life and all that. Now I have half an hour with each patient. So they're just happy to be able to have their answers, their questions answered. Just that makes their anxiety go down because they can understand their problem and they have a certain vision of the plan we're going into. So just by seeing me and answering their questions, they're already better off than waiting at home and wondering what's going on.
What do you wish the public system could learn from what you're doing?
Oh, wow. Well, I know it's hard to say. I know the lack of staff at the hospital is very, very critical. And honestly, we need more people in the system to try to take more time with each patient, try to understand better their problems, to try to, so having 60 patients in a clinic, telling them, I'm going to operate you next week, you come to the hospital, we cancel your surgery, you had planned your babysitters and your wife was going to be at home for the kids because you were getting operated. So it's not an easy question, but I think the lack of personnel, we need to work hard on that and bring people back into our system and make it a nice and healthy place where we want to work. Because it's unfortunate to say, but working at the private clinic, the ambiance is way different than what I would feel in the last few years at the public hospital.
Dr. Dahan, we have to leave it there. I want to thank you for coming on in the fascinating discussion. I appreciate it.
It was a pleasure. Thank you very much, Mr. Miklos. Have a good weekend.
You too. That's Dr. Philippe Dahan, orthopedic surgeon at Clinique Médicale Lacroix.